Hi, my name is Matthew Shahab, and this is John Kwan. We're both doctors of physical therapy here at Core Performance PT, and today we're going to be showing you the standing cane series for shoulder mobility.
Great, so this is a progression of our level 1 supine cane series to increase shoulder range of motion. Now we're going against gravity, so a little bit more challenging. Same concept, shoulder a little bit wider than shoulder stance, overhand grip. And notice how Matthew is elevating the arm. Notice his reference of his neck. He's not hiking his shoulders. We don't want that upper trap compensation. Good. And then you want to go into that sagittal view. Good. Good. And then a common compensation pattern when you're stiff, if you've got those stiff joints because of post-operative conditions or capsule restrictions from frozen shoulder, you want to really get that arm up, but you don't want to do it at the expense of going into that lumbar lordosis. That can cause back pain or injury. So make sure that you keep those transverse abdominals engaged throughout the movement. Again, breathing into that end of range. Good. And again, we want to be really discerning of what we feel. You want to feel a stretch. You want to feel that the joint is mobilizing. Things are stretching. We don't want to feel that sharp pain, that stabbing pain. Shoulder very sensitive to angles, so try to change the angle so that you feel more of that stretch. Great. Now we're going to go into the shoulder abduction. Notice how he's utilizing the cane in the palm of his hand. Again, you can use an umbrella, you can use a golf club, you can use a baseball bat, whatever you got. Okay? Good. You do it on both sides? Good. Again, if you feel like you're really jammed up here, all it takes is a little bit of a fine-tuning, change the angle a little bit, bring a little bit more forward, and that'll give you an opening of the shoulder joint to get that maximum range of motion. Good, now we're going into external rotation. You want to keep that elbow neatly tucked against the side of his body. Good, and using that opposite arm to really gain that stretch. You can do it statically or you can do it dynamically. I say a little bit of both. Dynamic movements to warm up and then some static holds at the end, holding it for 5 to 10 or 20 seconds, whatever you guys can tolerate. Most importantly, you want to feel like the range of motion is improving as you're doing this. Next, we're going to go into this shoulder extension range of motion. Notice he's squeezing through his periscapular muscles, his shoulder blade muscles. He's extending his chest out and bringing his arm back. Again, this is not only a good mobility exercise, but also a good scapular stability exercise. Great. And then we're going into that, kind of transitioning to that hand behind the back position. Very important. Commonly when people have restrictions, very difficult to really get your arm up to, click on that bra or scratch your back. And this is a good introduction to get that range of motion to make that task a lot easier. And then progressing to the more advanced hand behind the back stretch, grab it as such, utilizing that opposite arm, driving that cane up toward the ceiling and feeling a nice stretch. Notice his shoulder is not forward, but his shoulder is back because that's going to recruit the scapular muscles and free up his shoulder and allow more range of motion to occur. Again, use pain as your guide, static and dynamic movements. Number of repetitions and holds is variable to what you can tolerate. When in doubt, ask your physical therapist or your medical provider because we don't want you to harm yourselves. Great exercise to increase shoulder mobility. Thank you.